Let's talk about problems that can result as a lack of cultural sensitivity among healthcare workers. As you know, many strategies need to be looked at when you're looking at cultural differences to get patients to either understand or comply, or maybe the healthcare provider has to adjust care plans and treatments to facilitate the patient to reaching his or her goal of health. So when you look at a problem, it can be twofold. It can be patient-related as well as health system-related with regard to factors, okay? The patient-related factors are usually cultural characteristics of patients that prevent them from getting fair and adequate treatment in an organization that is not culturally competent. Health system-related factors are organizational dynamics such as employees, employee attributes, and biases that influence the methods used to treat patients. But think for a minute about a lot of the different cultures and the different cultural norms that people adhere to on a daily basis. Many cultures don't believe in getting health care unless something physically hurts. So something like hypertension that you can't feel or see would not be considered an important area for a patient that has this belief to pursue treatment. And in an incompetent organization where, again, there's a cultural incompetency, they may not understand what they need to do to, one, understand and respect where the patient is coming from, but two, to figure out how they can arrive at a negotiated agreement so that the patient can take advantage of some of the treatment options available to him or her. Other issues with cultural incompetency are making fun of people and their beliefs. Some people have different jewelry that they wear. It might be earrings in their ear or in their nose or in their lips. There might be tattoos and body markings. There may be treatments such as acupuncture and other things that more or less have a what we would consider a negative impact on the body, and we may even, because of our ignorance, our cultural ignorance, think that they were being abused by another person. So there are so many problems that can erupt that relate to the fact that people are insensitive to others' cultural values and norms. And again, language can come into play. Low income and education. Again, if we don't modify our teaching plans to the level of education and to the economic needs of that patient, they're going to be in trouble and they're not going to get the proper care and treatments that they need, or the education with regard to nutrition and whatnot. If someone is poor and can't afford certain foods, it would behoove the healthcare provider to come up with strategies on how to overcome that and how to adapt the nutritional needs of the patient and the dietary needs, maybe based on culture, and how you can bridge the two together so that there's a better outcome for the patient. Many people don't understand or lack health education. And if we don't communicate effectively, and if family members and the patient aren't native to English, then we need to look at how we can get interpreters or community members that speak the language and also speak English to help with getting the patient what they need and to communicate with them so that the health education can occur. Workforce diversity. There's people love to see healthcare professionals look like them. And there isn't always a match between healthcare professionals and the patients they've served. We've talked about this before, and that's where, when we were talking about developing cultural diversity in the workforce, this is really an important piece to look at. Payment may be another issue, and insurance, and helping to work with people to assist with those uninsured patients or community members that need services and how to help them get them. And again, it behooves us as healthcare providers to understand that. Some people are too proud to take a handout, but there are resources available that maybe will work for these particular groups of patients. So again, you can think of many, many potential problems that can result as a result of cultural insensitivity. I mean, eye contact, space, communicating, verbal and nonverbal cues with people are all issues that can create a culturally insensitive attitude towards another person. And we need to be aware of those and look at ourselves and how we see things and come up with a healthy, negotiated plan to help these people to be healthier and better in their pursuit of their healthcare needs.